Hi everyone. Today we are going to see about violence against doctors. So 100 years back in Journal of American Medical Association, it was stated that no physician, however conscientious or careful, can tell what day or hour he may not be the object of some undeserved attack, malicious accusation, blackmail, or suit for damages. So with this in mind, we'll go into our video now. So we are going to see about reason for violence against doctors, precautions that can be taken by the doctors as well as hospitals to prevent violence, role of media and government in taking actions and also precautions against violence against doctor, and what is the protection offered by law in current situation, and a need for central act, a unified act across India, across the country, to protect the doctors and healthcare personnel against violence. And also how this type of violence against healthcare professionals or healthcare service personnel can affect or impact the society. So what are all the forms of violence against healthcare personnel? Physical violence, abusive words, psychological harassment, damage to property, criminal intimidation, defamation. So all these are considered as violence. So what is the reason for violence? We will see about the patient factors first. So intoxication or substance abuse. Whenever a patient is under the influence of alcohol, any other substance, he may act violent. So in such cases also, we have to be careful that we take necessary steps and also necessary precautions to prevent violence. And also psychological disturbances, fear or anxiety about the disease, financial crisis, financial situation of the patient, young individual, precious child, and only breadwinner. Sometimes the person or the patient may be a single earning member of that family. So suppose he falls ill, the emotional stress will be more in that situation. So what are all the precautions we can take to avoid violence? What a physician should do? Immediate emergency care. Suppose a patient or a person comes to you in an emergency situation, so you should not delay. You should attend the patient promptly. You should not wait for consent, which we have already discussed earlier in the previous video. So we have to attend him and give proper treatment without fail, without any delay, in order to save the life of the patient. And also timely referral. Once you have given first aid, if the patient needs any super specialty care or you need to refer the patient to a higher center. And also frequent patient visits. So the doctor should frequently visit his inpatients and check them and explain them about the conditions, the illness the patient is having. Okay. And also periodic disclosure. Periodic disclosure is disclosure of information about the seriousness of the illness or the condition of the patient to his or her relatives. So it will be very useful so that they can make up their mind and they will not underestimate the seriousness of the illness. And also punctuality, less waiting period. Nowadays, whenever we go to a clinic or any hospital, the waiting period is very high. So that has to be reduced reasonably, as well as the load of the patient is also very high, which can be also limited. And next is ethical practice. This is a very important one. Any doctor or any healthcare professional should not get involved in any unethical practices. And interpersonal empathy. It is diminishing now between the doctor and patient. So the doctor should always understand the feelings of the patient, and he should be able to understand what the patient thinks, and he should make the patient comfortable, make the patient understand the situation of his illness, and also probable outcomes has to be explained to the patient, and he should act according to what the patient thinks. So what are all the steps that has to be taken by a hospital? The hospitals or the institutions has to ensure that they have sufficient manpower, good quality services, transparent billing systems, provision of necessary documents to the patients, surveillance cameras, security personnel, display of legal provisions and punishments. And also there should be a complaint or grievance redressal system. If suppose your patient is having some grievance, the hospital or the management should have a grievance redressal system where the patient can approach and tell their grievances, and also solutions can be sought out. So what are all the responsibilities of the patient and their relatives in avoiding the healthcare violence? So here, the patient or the relatives must not underestimate the seriousness of the illness or injury. And also they should try to sort out the grievances through proper grievance redressal forum instead of sorting through violence. They should also know a damage to hospital property and violence against doctors or paramedical personnel or criminal offenses, and they'll be punished by law. A doctor always tries his best to save the life of the patient, but it may not be 100% effective in all cases. And there is no 100% cure to any disease. So that the patient has to understand. What are all the responsibilities of the media? The media should not sensationalize the news, and they should not spread any rumors or false news. Before publishing any news about a medical negligence case or about a doctor or a hospital or institution, they should always check the credibility of the information. Also, any false news may literally destroy the life and career of a doctor. I think all the media personnel should keep this in mind because they are destroying the professional career or life of a doctor. What are the responsibilities of government? So government should provide health education and awareness programs and also about preventive medicine, especially in conditions like COVID. It was a pandemic. COVID was a pandemic. So in such situations, there will be panic among the public. They doesn't know it is a new disease. They doesn't know, even the doctors were panicked during that time. So it is the duty of the government to ensure the security and safety of the public as well as the healthcare personnel. Okay, so it should be done through health education programs, awareness programs, and also by preventive medicine. Adequate facilities and manpower at primary, secondary, and tertiary centers should be provided. Also, our government, our Indian government or our country has to enact a central act, a uniform act throughout the country to protect the healthcare personnel against violence. So at present situation, how does the law protect us? We will see about one by one. So criminal law, civil law, epidemic diseases act, state legislations, and also there is a healthcare service personnel and clinical establishments prohibition of violence and damage to property bill. So we will see them one by one. Under criminal law, IPC. So what is hurt? It is bodily pain, disease, or infirmity caused to any person by anyone. So what is the punishment for voluntarily causing hurt? It is imprisonment to 1 year or fine up to 1,000 rupees or both. If someone hurts a doctor, case can be filed under this section. And what is the punishment for voluntarily causing hurt by dangerous weapons or means? Like dangerous weapons means any weapons used for shooting, cutting, stabbing, etc. So, or sometimes poison or animals. All these are considered as dangerous weapons or means. So, imprisonment up to 3 years or fine or both. What is section 320 IPC grievous hurt? So, grievous hurt includes emasculation, permanent privation of sight of either eye, that is loss of vision, permanent privation of hearing of either ear, that is loss of hearing, privation of any member or joint, destruction or permanent impairing the powers of any member or joints, permanent disfiguration of the head or face, fracture or dislocation of a bone or tooth, any hurt which endangers life or which causes the sufferer to be during space of 20 days in severe bodily pain or unable to follow his ordinary pursuits. Here the term ordinary pursuits means his day-to-day activities. So if any of the healthcare service personnel suffers any of these injuries, then it can be booked under grievous hurt, section 320 IPC. So what is the punishment for grievous hurt? It is imprisonment up to 7 years and fine. Suppose this grievous hurt is caused by using a dangerous weapon, then the imprisonment is up to 10 years and fine. Also, there is offenses of defamation. Section 499 IPC says that by words either spoken or intended to be read, or by signs or by visible representation, makes or publishes any imputation concerning any person intending to harm. So this is known as defamation, either by words or publishing any articles or anything that can be read in a social media or media is a defamation. So what is the punishment for defamation? Simple imprisonment up to 2 years, or with fine, or with both. So criminal intimidation. Whenever someone threatens a healthcare service personnel, he can be booked under this section, section 503 IPC. Threatens another with any injury to his person, reputation, or property. So what is the punishment for this? It is imprisonment up to 2 years, or with fine, or both. In case the threat is to cause death or grievous hurt, destruction of property by fire, impute unchastity to a woman, then imprisonment up to 7 years, or with fine, or with both. Similarly, any affected healthcare personnel or clinical establishments can file a civil suit for permanent injunction, compensation, and defamation. So we have an act called Epidemic Disease Amendment Act 2020. So this act provides protection to healthcare service personnel during an epidemic. So here the healthcare service personnel includes doctors, nurses, paramedical workers, and community health workers, and also any person empowered to take measures to prevent outbreak of the disease. It is during an epidemic. So what is considered a property here under this act? Any clinical establishment, mobile medical units, and quarantine facilities. So these are considered as property. So an act of violence, what does an act of violence means under this act? It is harassment, harm, injury, hurt, intimidation, or danger to life, obstruction or hindrance to discharge his duties, and also loss or damage to property or documents. Already we have seen who are healthcare service personnel, and also what is property, and also what is act of violence. Next, what does section 2B of Epidemic Disease Act says? Says that no person shall indulge in any act of violence against a healthcare service personnel or cause damage or loss to any property during an epidemic. So whoever commits or abets commission of an act of violence against healthcare service personnel, abets or causes damage or loss to any property, is liable to punishment. So what is the punishment here? It is imprisonment not less than 3 months, but extending up to 5 years, and a fine of rupees 50,000 to 2 lakhs can be imposed. So when anyone causes grievous hurt to the healthcare professional, then the imprisonment is 6 months to 7 years, and a fine of rupees 1 lakh to 5 lakhs. Under this act, any offense committed against a healthcare service personnel or a damage to a healthcare institution is cognizable. Cognizable means the police can arrest without any warrant, and also it is non-bailable. The investigation should always be done by an officer, police officer, not below the rank of inspector. And also the investigation should be completed within a period of 30 days after filing FIR. Once the court starts the trial procedure, the inquiry or trial shall be completed within 1 year. So these are all the provisions under this act. Another important provision under this act is the reverse onus of proof. What is reverse onus of proof? Suppose if someone files a complaint against another person, the one who files the complaint has to prove that he has committed that offense. Whereas in this case, any violence in this case booked under this act has reverse onus of proof. That is what it says. Section 3C. The court always presumes that the offense has taken place. The court will presume that the offense has happened. It is the duty of the accused to prove that he hasn't committed any offense. And also, the court presumes culpable mental state of the accused. He has to prove that he didn't have any intention to cause this act. And also, burden of proof. The burden of proof provided should be beyond reasonable doubt. So section 3E says that in addition to punishment, compensation for hurt and grievous hurt should be given to the healthcare service personnel. The amount shall be decided by the court. Also, damage to property, the compensation shall be twice the amount of fair market value has to be paid as compensation. In case someone fails to pay the compensation, then it shall be recovered as arrear of land revenue under Revenue Recovery Act 1890. So in India, so many states have their individual or their own acts and ordinances. State legislations are there. Nearly 18 states have their own state legislations to protect healthcare service personnel against violence. So we will see about the Tamil Nadu Medical Service Persons and Medical Service Institutions, Prevention of Violence and Damage or Loss to Property Act 2008. So it includes the definition for Medicare service institution. That is central and state government hospitals or institutions, private hospitals, any private maternity homes and private nursing homes. So who are all the Medicare service persons? Registered medical practitioners, registered nurses, medical students, nursing students and paramedical workers are included as Medicare service person. So what is the punishment for causing violence under this act? The punishment is imprisonment not less than 3 years, which may extend up to 10 years and with fine. And also the offense is cognizable and non-bailable. In addition to the punishment, the accused or the convicted person is liable to pay compensation for damage or loss caused to the property. Here the court shall determine the amount to be paid. What will happen if he fails? Again, the same as in the Epidemic Diseases Act, it will be recovered as an arrear of land revenue under the Act, Tamil Nadu Revenue Recovery Act 1864. So we are in a dire need for a central act. Even though some states have their own acts and ordinances, many acts of violence against healthcare service personnel have gone unpunished. So what is the need? We need a unified act throughout the nation for violence against healthcare person. So that is a more rigid act is needed. So currently there is a bill proposed by the central government, which is in a bill stage. Its draft has been proposed and it will be submitted for approval. So the healthcare service personnel and clinical establishments prohibition of violence and damage to property bill 2019. So what does this bill says about violence against doctors? So it says punishment for violence against healthcare service personnel and damage to property is imprisonment not less than 6 months, which may extend up to 5 years, and a fine of rupees 50,000 to 5 lakh rupees. Suppose someone causes grievous hurt to the healthcare professional, healthcare service personnel, then the punishment is imprisonment not less than 3 years, which may extend up to 10 years, and a fine of rupees 2 lakhs to 10 lakhs. Again, here also, the offense committed is cognizable and non-bailable. The investigation should be done by a police officer not below the rank of Deputy Superintendent of Police. It is, whereas in Epidemic Disease Act, the investigation should be done by an officer not less than a rank of inspector, whereas under this act, this bill, the investigation should be done by a police officer not below the rank of Deputy Superintendent of Police. In addition to the punishment, the person is liable to pay compensation for committing violence. So twice the amount of fair market value of the damaged property should be paid as compensation. And also it includes rupees 1 lakh for causing hurt and rupees 5 lakh for causing grievous hurt to the healthcare service personnel. So section 9(1) says failure to pay compensation shall be recovered as an arrear of land revenue under Revenue Recovery Act 1890. So this is what the bill says. It also should include, the bill should also, what I'm thinking is the bill should also include a time frame for investigation and trial process, and also about the reverse onus of proof, which has been given in the Epidemic Diseases Act, that has not been mentioned in this act. So it has to be included to make it more protective. Okay, so I came across an interesting quote. It says, when the white coat turns red, the society turns black. So that is what the impact on the society, the impact of violence against healthcare service personnel will cause on the society. When the white coat turns red, the society will turn black. So once these type of violences increase, the doctors will be afraid to practice medicine. So what they will do, they will start practicing defensive medical practice. They will be doing additional and unnecessary investigations because they will be under the fear that they will misdiagnose any or miss any investigations or miss any diagnosis. So they will be doing additional and unnecessary investigations to protect themselves. And also the doctors would refuse to perform dangerous procedures because they'll be afraid to perform any risky procedures. What they will do, they will just avoid performing those procedures. This will in turn affect the well-being of the society and also well-being of the patient. So there will be degradation of the doctor-patient relationship. The mutual trust will not be there because of this increasing violence. And also there will be subsequent increase in cost of treatment and also a decreased access for the patient to medical services. So these are all the impact on the society. So what are the possible solutions we can think of to avoid violence or to protect doctors or healthcare service personnel from violence? So yes, Central Act, already there is a bill. So we have to see what are all the things that can be added to that bill. And also interpersonal empathy, which is the most important thing, which has started diminishing now. And also critical thinking. The doctor should have a critical thinking on handling situations. Mostly elder doctors or the senior doctors, they command respect from their patients. Similarly, a junior doctor is prone for more violence, whereas an elder doctor or a senior doctor is capable of handling such situations. So they are prone to less violence. So they young doctors or the younger generation of doctors has to be trained to have to improve their critical thinking in handling such situations in a peaceful manner, or how to handle those situations. And also mock drills. When we are having mock drills for fire accidents, why not we have a mock drill for young generation of doctors while studying or while learning medicine? Why not have a mock drill for them to handle these type of violent situations? And also legal awareness. Most of the healthcare service personnel or doctors, they lack legal awareness about the medicine. So that has to be taught to them, or they should try to acquire knowledge about the legality involved in medical practice. And also patient education. It has more value because when you educate the patient about the seriousness of the illness and the outcomes of the procedures, then definitely the patient and the relatives, they might understand the situation and they will not get emotionally stressed, and also they will not undergo any violent activities. And also time management. So make sure you spend adequate or sufficient time with your patients and explain to them about the procedures and the outcomes of the procedures and prepare them mentally to face the challenges. And the most important thing is cost efficiency. Make sure that you discuss with your patients and their relatives about the procedures or the alternative procedures available, their cost of treatment, and make them choose the treatment suitable for them. And also you should explain about the drawbacks of choosing the alternative treatments. If the patient understands the risk and accepts to go with that, then please go with that procedure. So these are all the possible solutions that can be thought of avoiding violence against healthcare service personnel. Hope you all understand about violence against doctors, what are the legal provisions that can help this healthcare service personnel in order to protect themselves, and what is needed in this current situation to protect ourselves. Thank you.